Hey guys, this is Dr. Theo Swala. You're welcome to Dr. Gilead Show. Today we are on WBGR Radio and on Facebook Live. I want to welcome you to today's show. Today is Thursday, January 26, 2017. We are on WBGR Radio and Facebook Live. You can call on 301-429-9247, 301-429-9247. Today we are talking about psychotropics. Psychotropics, and these are medications that are used to treat mental health issues. All right. As we usually do, I want you to please do not use what you hear on this platform to make a diagnosis of yourself or treat yourself. And also, I want you to please, it's always good for you to see a trained personnel, a physician, a prescriber who can do the appropriate diagnosis and treat you appropriately. Dr. Gilead Show, the producers, as well as the guests on this show, cannot be held responsible for what anyone does when they, for anything anybody does based on what they hear on this platform. So please get the appropriate diagnosis and treatment from a trained personnel and you'll be properly taken care of. All right, today we are talking about psychotropic medications, the use of psychotropics. These are medications that we use to treat psychiatric illnesses. And these medications alter or affect the neurotransmitters or chemicals in our brains, and they help us to stay stable for those who have mental illness. We've talked about on this platform the chemicals that affect the brain. These are called neurotransmitters, and they either increasing it or lowering it or keeping it where they should be will keep anybody stable. So this is what we're going to talk about today. And there are different types of them. Today we're going to talk about antipsychotics, and these are the psychotropics that are used to treat psychotic symptoms. Psychotic symptoms like as we see in schizophrenia. On this platform, we talked about schizophrenia before. The medications that are used to treat schizophrenia are called antipsychotics, medications that work against psychosis. So you're welcome to the show. Please feel free to call on WBGR Radio on 301-429-9247. If you are on any of these medications, or you have a family member who is on an antipsychotic or has been before, you have a contribution or you have a question, please feel free to call on WBGR Radio 301-429-9247. All right. Today we the antipsychotics we were going to talk about. We have two types of antipsychotics. What we call the first generation antipsychotics and the second generation antipsychotics. The first generation antipsychotics are the older medications. They are the medications that were used a long time ago, before the advent of real good medications. These are still good. We still use them because of how effective they are, and how and the side effect profile that probably are somewhat less than the older ones. But all the medications have some problems. So we have two types: the first generation antipsychotics and the second generation antipsychotics. Now, there are other medications that are also used to treat psychotic symptoms. All right. Now, when people have symptoms of mental health, of mental illness, such as hearing voices as we have talked about on this platform, or seeing things. And remember, as we said, some people sometimes could become paranoid. They think someone is out to get them, or someone is out to harm them, or that like the CIA or the FBI is watching, or there are cameras in their houses. These are all psychotic symptoms. These are not real, but of course the patient sees it as a real disease, and they feel that the way they feel is real. It's hard to tell them that what you're seeing is not real, or what you're hearing or feeling is not real. Some people have what we call tactile hallucinations, and that is they feel things crawling on their skin, on their body, but there's really nothing crawling on their body or nothing biting on their skin. But this is exactly how they feel, and these are all part of the symptoms. But today, because we're talking about the medications, we're going to look at the two groups of medications that we use in treating psychosis. I'm going to take the first one, or the first group, which we call the first generation antipsychotics. These are things like thorazine, good old chlorpromazine is one of the oldest antipsychotics. So it's either thorazine, chlorpromazine, or some people call it Lagactil. We also have in the old generation antipsychotics things like haloperidol, the good old Haldol. You have other things like flufenazine, which is also called Prolixin, and other ones like perfenazine, and just a few of them. Now, these medications, these first generation antipsychotics, affect only one chemical, and that is the neurotransmitter, the dopamine. Dopamine is the main one that these antipsychotics affect. And what happens is when the level of dopamine is high, you have people having the psychotic symptoms. But if the dopamine is low, then they have other symptoms altogether. So we're going to look at the antipsychotics, the first generation antipsychotics, and we'll look at how they affect these symptoms. Now, the old generation antipsychotics, or the first generation antipsychotics, will reduce the effect of dopamine on those receptors in the brain. So they affect those. Now, once they block the dopamine, then the effect of the high dopamine is gone. So the symptoms that the people have of hearing voices, seeing things, will no longer be there. Now, the effect of these medications are good. They help people, but also they have side effects. As we know, all antipsychotics, all medications, as a matter of fact, including Tylenol or aspirin, antibiotics, antidepressants, pain medications, all have side effects. So, side effects with antipsychotics is not exclusive to antipsychotics. All medications have some side effect, but as a physician, you weigh the side effect profile and look at the benefits that this medication will have on the individual. And you discuss it with the individual, and you all agree on what should be done, how to manage the side effects if they occur, and you start the patient on the medication. That is how exactly this happens. So we have a good effect. We also have side effects of these medications. Now, for example, the first generation antipsychotics, you have side effects like muscle contraction, and it could affect any muscle, especially the what we call not the smooth muscles but the striated muscles, but that's the muscles that bring about muscle movements. For example, you could have contractions of muscles around the eyes, muscles on the tongue, muscles of the face, muscles of the neck. It could affect muscles in the legs and in the hands. So when a person has this side effect of contraction on the muscles, what happens? So you see a person who has contraction of muscles that move the eyeballs. Our eyeballs go that way, and it looks left or right. There are muscles that bring that effect. So when these muscles contract, especially the muscles that roll the eyes up, you have the eyes rolling up. So I have patients who are on these medications. They come to me, they say, "Doctor, my eyes are rolling up." So it's because of the muscles in the eye, in both eyes, that are contracting. So the eyes roll up. When you have contraction of the muscles of the tongue, the person has a feeling that the tongue is heavy and is stuck in their mouth. Sometimes you also have contraction of the muscles of the larynx, the muscles of the larynx inside. So when those muscles contract, the person feels choked. They feel like they're going to choke. So it's a very discomforting feeling. It's tight. They have difficulty breathing, and people can really die if something is not done. So these are medications that these medications can cause these problems. So muscle contraction, the eyes roll up, the tongue gets thick, and if it's muscles of the neck, they have what is called torticollis, and that means you see the person, the neck is bent to one side. Sometimes the muscles of the hands and legs, when the muscles of the legs are contracted, you see the person cannot walk. You see somebody walking with the feet that way. These are all side effects of these first generation antipsychotics. Now, another side effect of these first generation antipsychotics is excessive salivation. They have produced so much saliva, and you see the person, because the saliva in his or her mouth is so much, they're drooling all the time. So they're sitting there, bent over, and saliva pouring out of their mouth. This is one of the side effects of the first generation antipsychotics. Now, they also have excessive sedation. So some of these medications can make you too sedated. And because they're too sedated, they're there, bending forward, drooling, and sedated. And all put together, you have what is called a zombie-like look of a person on these medications. And is not a good look. It's not a good way. You see your family member drooling, zoned out. And I see a lot of people come to me from other doctors, and they say, "I don't want to take the medication. I feel like a zombie. I can't keep my eyes open. The saliva in my mouth, my tongue is heavy, my eyes are rolling up." This happens all the time. But there are antidotes. There are medications we use to stop that. So these are some of the side effects of the first generation antipsychotics. You also have gynecomastia, and that is, in males, they have breast enlargement. You can see on TV some attorneys and advertising, "If you have had breast enlargement, call us and we'll make money for you." These medications, all of them, all antipsychotics, can cause breast enlargement in males. But this is all because of the effect of the medication in the brain. So the person, the man, will begin to produce a chemical or a neurotransmitter that helps in breast enlargement in females. So that will cause the male to have breast enlargement. But it's difficult to say who this can happen to. You have a person, you can have 3 or 10 people come by, only one person will have breast enlargement in males. So there's no way any doctor can know who this will happen to. Also in females, because the prolactin, which is the chemical that increases breast milk production in females, so females with this on these medications will have enlarged breast. Sometimes they may have milk coming out from their breast, and also it could affect their monthly cycle. So you have females on these medications, they won't see their period anymore, and their breast is enlarged, like they are breastfeeding. These are the side effects of the medication. So these are short-term side effects, but we have what I call long-term side effects, and that is people on this medication, they've been on it for quite a long time. They have what we call involuntary muscle movements, and this could affect any muscle in the body. Now, if you have seen people in your neighborhood, in a hospital, or in the doctor's office, and they are blinking, you see their eyes are going that way, the blinking, uncontrollable blinking, is all because of the long-term effect of the antipsychotics on the muscles that close and open the eyes. You also have, you could have these effects, long-term side effects on the muscles of the tongue and on the lips. So you have people, their tongue is always going, or their lips are moving all the time. They're doing that. These are all side effects of the medication. And other side effects, long-term side effects now, you see people shaking. Their hands are shaking, and they can't stop it. When they're doing stuff, they're holding stuff, they're doing things, it may stop, but once they keep it resting, it keeps shaking. Those are called resting tremors. These are long-term side effects of the antipsychotic. There are other people who have what is called shuffling gait, and that means they walk in short, quick steps. Harder to lift up their feet off the ground. It presents like Parkinson's disease, and they have what we call Parkinsonian syndrome. So it's not, they don't have Parkinson's disease, but it's Parkinsonian syndrome from the medication. So these are some of the side effects, the short and long-term side effects of the first generation antipsychotics. Now, let's look at the second generation antipsychotics. And these are things, and I'm going to talk about the management, how to treat this. But my intention is to inform everybody out there, people with mental illness, family members, and friends. So when you see this, one, you can empathize with your family member. You can also talk with your doctor so that they will give you the right medication, or at least educate you on what is going on. Sometimes you may have these side effects, but it's doing the job. It's keeping you mentally stable. You're going to work. You're having a good time with your family. So most people will stay on it, even though it's causing them some side effects. All right. I see Dwight Ward, and I also see Chuck from Laurel. Thank you for tuning in. So let's talk about the second generation antipsychotics. But before I go to that, I want to remind you that this is Dr. Gilead Show. We're on WBGR Radio. You can call in on 301-429-9247, 301-429-9247. If you have some information, some question, or some clarification, or some experience with some of these antipsychotics. All right, so let's go to the second generation antipsychotics. These are newer medications that have some similarity in the way they work, but also have other ways they affect the brain. Overall, they are better medications because they affect other chemicals in the brain. They help with the mood, and also they help with the voices or the paranoia. So these are medications like risperidone or Risperdal, Abilify, or medications like Zyprexa. You also have other ones like Seroquel, Latuda, Fanapt. These are all antipsychotics that are out there. Very good medications. They're good, but of course, most of our medications have side effects like anything else. Now, these newer antipsychotics block both dopamine, and they also have effect on serotonin. Serotonin is the chemical or the neurotransmitter that helps us with our mood. That's the one that if you're feeling sad and I put you on a medication, on such medication, your mood will get better. You begin to feel happy again. So because of the effect on different chemicals in the brain, these new medications are used for psychosis. They are also used for bipolar disorder. They are also used for to augment depression. So, for example, you have someone who has depression. They are on antidepressants, but they're not getting better, or they're getting better just a teeny bit. So you add one of these new medications like Abilify, also Latuda. Latuda is one of the good medications, and I'll talk more a little bit about them. And also they help with the mood as well as the psychosis. Now, the antipsychotics, both the first and second generation, the good thing is they can be given as injections. There are some you give as injection once every 2 weeks. There are some you give as injection once a month. But also, great is there are some, or there's one now, you give once every 3 months. So, things are getting better. Many years ago, there were just 1 or 2 antipsychotics, or even there were no antipsychotics. So once you are ill, you have one of the psychotic symptoms, what do? They put you in a straitjacket and put some cold water in the jacket, put some ice, and you chill out. You can't run because you're tied down. There were no medications to help. But good thing, medical research has come a long way. Now we have different medications. Some you give as oral tablets or capsules. Some you give as injections once every 2 weeks, some once a month, and once every 3 months. There are on the way some that you may give maybe once every 6 months, as the case may be. So we're making good progress, and I'm sure that things will get much better. I see Marty Lewis. Thank you for tuning in. Thank you very much, and I hope you are enjoying the show. All right, now the new or the second generation antipsychotics. Now let's look at the side effects of these newer medications. Sometimes they can make people very sleepy, sedation, and the worst of them all is Seroquel. Good medication, but it makes people very sleepy. I hear these days people are crushing Seroquel and snorting it, because how are you going to snort medication, guys? How are you going to snort Seroquel? That is no brainer, but it's happening. So people come, they're asking for Seroquel because it calms people down. When you're high, you snort some Seroquel, I hear it calms them down. So people are asking for it, looking for it. In jail, they're asking for it every day. That is messed up. You can't be snorting Seroquel. It destroys your nasal cavity, causes you more problems. So sedation is one major side effect of these second generation antipsychotics. Another big side effect is it increases appetite. So you see people, they want to eat. They eat, they get full, the next minute they want to eat. And people have told me they take their medications, they fall asleep, they wake up to go eat. So increase in appetite is another big side effect. And of course, that leads to weight gain. Weight gain is big. So there are some of them that are more that could cause more weight gain than others. These are things like Zyprexa, risperidone, but others like Latuda and Abilify don't cause a lot of weight gain. Latuda is good, doesn't cause a lot of weight gain. And also the side effects, or the other side effects, Latuda has a good side effect profile. That means it reduces the side effect. It doesn't cause a lot of side effect compared to all of them. Now, because of the weight gain, we need to check the weight. It's been shown that when people have this weight gain, or people who will be predisposed to gaining a lot of weight, it happens in the first 1 or 2, 3 months. So the American Psychiatric Association, as well as American Diabetes Association, have set out criteria of what must be done. So if your doctor wants to start you on these medications, you got to listen to this. First of all, before you are started on any of these medications, and these are the new or the second generation antipsychotics, your doctor must check your weight and record it. Now, because people gain weight, you check the weight before you're started on the medication, and every time you go to see the doctor for the first 3 months. And if there's not much weight gain, then you check it once every 3 or 6 months. But if there is appreciable weight gain or increase in weight that is so fast, the teaching is you must stop that medication and give something else. So that is weight gain, increase in appetite and weight gain. Now, it's also been shown that these medications can cause increase in blood pressure. So your doctor must check your blood pressure before he puts you on this medication. What will that do? It will give him a baseline. Okay, my patient is going to start on this medicine. I need to know what the blood pressure is before I start it. And that way, once he started, he will check the blood pressure every time you go for the first 3 months. And if the blood pressure is okay, the teaching is you can check it once a year or thereabout. But for me, to be on the safe side, I check the blood pressure once every 3 months or 6 months to keep a good eye on the medication effect. Now, these medications also can cause increase in blood sugar, and people can have diabetes. So, before your doctor starts you on this medication, or even shortly after, you must get what we call fasting blood sugar. And that is, you eat at bedtime, no food after 12 midnight, and the next morning, you go to the lab and they draw your blood. That is fasting, no food, nothing to drink, no sodas. They get your blood checked, and your doctor will record what your blood sugar is. That gives him a baseline on what the blood sugar is. So as he continues to check your blood sugar, he will see if it's getting worse or it's getting better. Now, those who have family history of diabetes, you may check it more frequently. So you have check it every 3 months after that. And if they have diabetes, you need to check it more often. All right, I think we have a caller calling in. Let's break a little bit and listen to what the caller is saying. Hello, you're on Dr. Gilead Show.
Hello.
Yeah, hi. Can you hear me?
Yeah, I can hear you.
Okay, how are you?
All right, all right.
Okay. May I know who I have the pleasure of speaking with?
Yeah, this is Dr. Prince Adekoya, a pharmacist in Williamsburg.
Oh, hey.
Psychotic Healthcare Pharmacy.
Right, so this is Dr. Prince. Dr. Prince, you're welcome to the show.
Yeah, it's a pleasure.
Yeah, Dr. Prince is a pharmacist in the area, and thank you for calling in. Dr. Prince, I know you dispense a lot of medications for some of my patients.
Yes.
And you supply both the pills and the injections.
That's true.
Yes. How much antipsychotics do you dispense on the average? How much of that?
Well, that would be about 7 to 10% of our total business volume per day or per month. Yeah.
Wow. Can you imagine? About 10%. That would tell you that antipsychotics are. A lot of people have the illness. Simply put, Dr. Prince, let me ask you, what is the name of your pharmacy again?
It's a Paddock Healthcare Pharmacy off Annapolis Road in Williamsburg.
Paddock Healthcare Pharmacy, and it's off Annapolis Road. And
Yes,
is a privately owned pharmacy?
It is. It is. It's family owned, and it deals with lots of specialty medications.
Good. Wow. All right. So, Prince, over the years, how much of injectables, the antipsychotics that we inject, how much of that has the prescription of injectable antipsychotics gone up, or is it still struggling?
Well, lots of the psychiatrists or the practitioners in this field actually tend to find it more convenient than using the pills just to enhance compliance, because that way they do have the assurance that the patient actually is being managed properly and having the medications in their system to manage their conditions, versus when the patients are left alone to with the family members to use the oral pills, which you don't really have so much buy-in from the patient. So you have treatment failures with the pills. So based on that, the injectables are actually on the rise, and they do have very good convenience in terms of the dosing. Sometimes you have it as weekly dosing, and some you have monthly, some even have quarterly, which makes the control of their conditions much manageable.
That is powerful. Hey, Dr. Prince, I know that one of the injectables comes. You give it every 3 months. I have a patient that takes that now. Are people asking more of that, or they still staying on the 2 weekly or monthly from your experience?
Well, sometimes you have the barriers caused by the insurance coverage is an issue with the patient's insurance. With the state plans or some federally funded plans, you could get the physician, the physician prescribing physician to get an override or prior authorization to get that to go through. That could be cumbersome based on how busy the practitioner is. But on the hindsight, you do find that there's more buy-in from the insurance companies to pay for it. They're quite expensive. The ones that are quarterly could go as high as $5,000-$7,000.
$5,000.
Weekly ones are close to $2,000 every 2 weeks. So that's a whole lot of expense if the patient had to come out of pocket. But thankfully, most of the patients do have good insurance coverage through the state or the federal Medicaid funded program. So that helps a lot.
But you know what? I did inpatient as a clinical assistant professor at University of Maryland. I tell you what, one inpatient admission will cost you about $20-something thousand. So if the insurance company pays $5,000 for an injectable every 3 months and the patient stays well out of hospital, I think it's worth it. It's really worth it.
Yeah, I do agree with that, and I think that's where the present Affordable Care Act helps out with that, because they're trying to reduce readmission into the hospital. It's quite expensive to the taxpayer when the patient gets readmitted, and also the risk to society when those patients are not managed. So it's a win-win if you could get more family members or patients to buy into the injectables, and it saves the taxpayer lots of money. It's also convenient for the patient, and just like I said, it's a win-win for everybody.
I agree with you completely. And from my experience, people who I have a patient right now, he struggled a little bit, And once I got him on the injectable, he's done well. He's gone back to college. He's doing well. He's playing sports, and hey, he is doing very well. And that is really that's a part of treatment that is exciting for me as a psychiatrist, as a physician. You have a patient who gets on these medications and they are stable, because the fear, the worry of every physician is his or her patient ending up in hospital every other month. So I think the injectables are very, very helpful. Hey,
they're very much cost effective. Yeah.
Right. Before I let you go, the Affordable Healthcare Act, the Obamacare. Hey, the new president is about to do something. What do you think?
Well, it's a double whammy. As good as the act is and the program is, getting more people enrolled in insurance despite their pre-existing condition. Most practitioners are not reimbursed enough for the effort they put in there. I know most people will disagree with that, but the truth of the matter is there are lots of costs and regulations attached to it. The new president either is going to replace it or repeal it. He has to have a replacement that still has those provisions that are quite good with the Affordable Care Act. That's not only good for the practitioners involved, but also good for the patients so that they can afford the insurance. Not everybody can afford the insurance, the premiums. So if they're going to repeal it or replace it, it has to have the good provisions plus improvements on the shortcomings of the program.
I agree with you completely. Hey, Dr. Prince, you got to come on my show one of these days. Bring padded healthcare to the show, and we can talk more about medications, how pharmacies can affect the life of my patients.
Sure. That's something we could work out down the line.
Okay. All right. Thank you so much for calling into the show.
Thank you.
Thank you, Prince. Have a nice day.
Bye. You too.
All right. All right, guys. That was Dr. Prince of Paddock Healthcare Pharmacy on Annapolis Road. He is a family-owned pharmacy, and he operates. He deals with specialist medications and general medications as well. All right, thank you very much, Dr. Prince. Now, we were talking about the side effects of the second generation antipsychotics. We've talked about increase in blood pressure, weight gain, increase in appetite, as well as increase in blood sugar. The other big one is increase in cholesterol. Cholesterol is big. I mean, we eat all these things. Once the cholesterol is high, what happens? It builds up inside the blood vessels and blocks blood flow to the brain, to the heart, to different parts of the body. Then what happens? You get a stroke, you get a heart attack, sudden death. So these medications can cause increase in cholesterol. So what happens? Before or shortly after you're started on these medications, you should get a baseline cholesterol level. Once you get the cholesterol level, then it should be checked again after 3 months. And if it's okay, the teaching is to check it every 5 years. But for me, in my practice, I check the cholesterol at least once every year, sometimes once every 6 months. It's better to stay on the safe side to make sure that your patients don't get high cholesterol or get heart attack. And you save the patient. It doesn't make sense getting the patient to be mentally stable and they die of heart attack. All right, that's cholesterol increase. Now, also, the new generation antipsychotics can cause gynecomastia, which is increased breast size, or males developing enlarged breast. That's why you see attorneys advertising on TV. If you are a male and you were on this medication and you develop enlarged breast, call our office and we'll get you money. Now, there is no way I, as a physician, can know the young man who can develop enlarged breast or not. So what we do is educate people, say, listen, this could be a side effect. We don't know who will have it. So if you're getting enlargement of your breast, then we need to stop the medication. So that is one thing that we do. So we need to look out for that. Now, these medications have these side effects that I have mentioned, but there are ways of treating it. Now, the muscle contractions, remember I talked about muscle tightness as well as muscle stiffness. So we have medications that we can use to stop that feeling. For example, when patients have muscle tightness, we give medication called benztropine, and I'm sure a lot of you have seen the medication or heard about the medication that is called benztropine. So we can use that to prevent that side effect. Oh, hi, Danielle. I see Danielle from St. Louis, Missouri. Wow. Thank you for tuning in, Dwight, Victor. Thank you. Danielle says that people really definitely need this information because there are, she knows some people who are on Abilify and on some of these medications. Thank you for tuning in from all the way from St. Louis. Thank you. So the treatment of these side effects. So you have benztropine to stop the muscle tightness, and I tell you, it is magical. You have a patient whose eyes are rolling up, who is so stiff they can't move. You put them on benztropine, and the next few hours they're well. Also, we use Benadryl, simple Benadryl. So, if you are on any of these medications, your doctor is out of town, you can't hit the emergency room, get the good old Benadryl. Good old Benadryl will take care of this problem. Now, we also have some what we call motor restlessness. They can't sit still, so you have a patient on these medications, especially the first generation antipsychotics, Haldol, Prolixin, Thorazine. They sit down, they get up, they walk, they sit down, they're pacing all over the place. There are medications to treat that, and we use medication like propranolol. Propranolol is a medication for high blood pressure, but it's also approved for what we call akathisia, which is motor restlessness. They sit down, they can't watch TV, they can't get themselves settled to do anything. Propranolol is used for that. But also the long-term side effects of the first generation antipsychotics, tardive dyskinesia, which is involuntary muscle movement of the mouth, tongue, or hands shaking. So we have to put them on medications that we actually use to treat Parkinson's disease, or we reduce the medication or increase the dose. Sometimes you increase the dose of the antipsychotic, they get better, or we stop it completely and do something else. Now, for the second generation antipsychotics, we talked about excessive appetite. So what do you do if you are on this medication? You eat healthy. You're going to eat healthy. You will have to eat less carbohydrates, because if you continue to eat carbohydrates, what will happen? You put on a lot of weight and it will not help you. So you have to eat, you eat healthy, you eat a lot of vegetables, you drink a lot of water. Now you must cut out soft drinks like sodas, Pepsis. I see some people that say, I love my Pepsi. Hey, Pepsi contains a lot of sugar. Mountain Dew contains a whole lot of sugar. Look at it, look at the bottle. You see almost a gram of sugar in a little bottle of Mountain Dew or Pepsi. Once you cut out those, you reduce the amount of processed sugar that goes into your body. You also need to cut out alcohol, because alcohol metabolism, alcohol breakdown ends up in sugar. So you end up gaining a lot of weight. So, but if you're on these medications, you just drink water, eat healthy, eat a lot of vegetables, and live a healthy life. 2, you have to exercise. Exercise regularly. Go to the gym. If you can't afford the gym, you go to, you can run in your neighborhood, do exercises. Number 3, outside exercising, eating healthy, you must do the monitoring. There are stipulated monitorings that you need to do when you are on Abilify, Risperdal, Zyprexa, Latuda, Fanapt, Seroquel. These good old medications, they're good. They help out. But we must learn to do the right things. Now, if your doctor is not maybe as a matter of oversight, and that means they forget to do the right things, if you are on these medications, write this down. If your doctor says, I'm going to prescribe any of these medications, say, okay, doctor, I think you need to check my weight. So you have to remind your doctor, you need to check my weight, record it. What is my weight today? And he records it. When you come back next time, you say, doctor, can I check my weight? I think this medication, I learned that it can increase weight. The doctor will remember to check it. So you must remind your doctor to check it. These side effects are what we call metabolic syndrome. Metabolic syndrome is increasing weight, increasing blood pressure, increasing cholesterol, increasing blood sugar. So, as a patient taking these medications, now it is the responsibility of your prescribing doctor to do these things. But the doctor is human. He may forget. If he forgets, take the initiative and say, hey, doctor, I think we should check my weight. Doctor, we haven't checked my blood pressure recently. Or, doctor, we haven't done my blood test. We need to check my cholesterol. We need to check my blood sugar. Or, doctor, I'm eating too much. My appetite is a lot. And I feel fat. Or my clothes can't fit anymore. Can we check my cholesterol? Can we check my blood sugar? If your doctor is not doing that, he's not doing the right thing. So you have to really let him know. And let's take a look at exactly the approved timing. And I want you to record this. So your weight, you need to check the first time you get in, and this medication is about to be prescribed. Your doctor needs to check your weight and record it. 2, before the medication is started, the doctor needs to check your blood pressure and record it. 3, the doctor also needs to send you to the lab, or if they have the capability of drawing your blood in the office, you do a fasting blood test. And that means you eat at night, but you don't eat anything until you don't eat anything after 12 midnight until the next morning when your blood is drawn. So the doctor needs to check your cholesterol, needs to check your blood sugar. Now, once these are done, you get on the medication. You get on the medication for the first month. When you come, the doctor should check your blood pressure again, check your weight. Sometimes one of the things that is recommended is to check abdominal circumference, and that is measuring your waistline around your navel, your umbilicus, because a lot of the weight people gain from second-generation antipsychotics happens around the abdomen, around the lower part of the abdomen. So you see people who were looking trim and fit, have the good abs, they start on these medications, they gain weight, they develop flabby fat. So sometimes the doctor might say, hey, look, I think I need to measure your waistline, but that will be around your umbilicus, and it's recorded. When you come back after a month, the doctor should check your weight again, check your blood pressure, and see how you're doing. Now, with the cholesterol and the blood test, that is done after 3 months. But I want to say this, with some medications, within the first month, some people gain so much weight. The weight gain is tremendous. Even though the medication might be working for you, At that point, you need to make a decision whether you want to stop the medication and do something else. You will work with your doctor so you two can agree on what needs to be done. And I've had a patient who cholesterol went up, but because he had been so sick in the past, before we got the right medications, we got him on the right medication, I said, listen, man, we need to take you off this medicine. He says, listen, I have been sick for over 15 years, eating from the trash, hearing voices, could not sleep. I would rather have my cholesterol high than to get sick again. He was working, he had his driver's license, he had a car, he was doing well. But what happened? When I checked his cholesterol, it was high, very high. So what did I do? I talked with his primary care physician, and we agreed on what needs to be done. He was put on 3 cholesterol medications. And I tell you, within 2 months, when it was repeated, the cholesterol has started coming down, and as at today, his cholesterol is below 200, which is the normal range, below 200 total cholesterol. And we put him on exercise regimen, good diet. He's exercising. He got a treadmill. He's exercising. He's eating healthy. He's not drinking soda, and he's doing well. So you have to find a way to work with your doctor so that you two can agree on what you need to do. Once you agree on what you need to do, then the result is amazing. You do so well. So I want to encourage you, you take the initiative. This is your health. This is about your life. If the doctor has an oversight or overlooks some things, you have to remind him. So the blood pressure you check the first time, and monthly, and if everything is okay, every 6 months. I try to do mine every 6 months at least, but the teaching is you can do it once a year. But who goes to the doctor's office and checks the blood pressure once a year? But originally, when you go to your psychiatrist, people don't check vital signs. People don't check for temperature, pulse, blood pressure, and weight. But because we found out over the years that these medications can cause increase in blood pressure, so it's mandatory now. Your doctor has to check it, at least your weight, at least your blood pressure. So that is one of the things that must be checked. And every 6 months to 1 year, your doctor should send you to the lab to check your cholesterol and your blood sugar. Now, my experience is sometimes I have to chase people down, and they think I'm doing well. I don't need to check my blood sugar. I don't need to check my cholesterol. So the doctor is caught at between the rock and a hard place. Should I stop giving you the medication because I'm liable if something happens? So I beg my patients, please go check it. And a lot of the times people go and check, but sometimes they come, they give you excuse every day. Oh, I'm sorry, I couldn't check it, I couldn't go, I have no transportation, I have nobody to take me. But still, I'm using this as a forum to educate you. You are on these medications, you have to take the initiative to go check your blood. If your doctor is asking you to do it, this is one of the reasons why you must do it. If you don't have insurance, work out a way that it can be done, because you're better off having a stable mental health and also not having a heart attack or not having a stroke. So I want to encourage you, if you are on any of these medications, please go and get your blood checked if your doctor sends you, and if he forgets, please remind him that I need to get my blood checked, I need to get my sugar level checked, I need to get my cholesterol checked. You don't want to have a heart attack. Now, these medications also, before I forget, can affect your sex drive. There are people who come to me, they say, since I started this medication, I have no emotions. I can't get an erection. The female says, I am dry. I can't achieve an orgasm. These could be the side effects of the medication. And I've had people tell me, hey man, I would rather stay well and not have sex. But I try to adjust medications because I know sexual health is also necessary. Even though you want to stay mentally healthy, you have to live a balanced life. So you can work out with your doctor to see what medications, what adjustments he can make or she can make so that you can stay healthy all round. You're healthy mentally, you're healthy physically, and also you can enjoy your God-given sexual desires. So these are some of the things that you need to do, but you need to work with your doctor. Now, overall, I want to say this. Antipsychotics are safe. They help out, but there is something there. They have side effects. The truth is, you cannot predict who will have these side effects. Whether it's muscle contraction, whether it is involuntary muscle movements, whether it is weight gain, increase in appetite, increased blood pressure, breast development in males, or milk from the breast in females, you cannot say who exactly could have any of these side effects. So, your doctor will always tell you these are the possible side effects. And you too, you and your doctor will look out for these side effects. If you have them, let your doctor know, and he would adjust your medications and you can feel better. Now, there are people who, because of the severity of their illness, once you try to adjust the medication, they get very sick. They end up in hospital. So it may be your doctor will have to look and make the right decisions for you. But of course, excuse me, it's with your consent. So you need to work with your doctor and take the right medications. I want you as a patient, family member, to watch out, take a look at the medications you are taking, know the side effects, and once you know the side effects, talk with your doctor and you can get better. Excuse me. So today we've talked about antipsychotics, the first and second generations. We've talked about the side effects. It is for you to know these and talk with your doctor, and so you can get better and stay healthy without the side effects. We have come to the end of today's show. I want to thank you, everybody, for tuning in on Dr. Gilead's show and also listening on WBGR Radio. We are here every Thursday at 1 p.m. So please tune in on Facebook Live and also on WBGR Radio. We'll see you again next week, Thursday at 1 p.m. Thank you, and see you again. You can also look at this recording on my Facebook at Dr. Theo, one word, Osoala MD, one word. So Dr. Theo, Osoala MD, Facebook Live. You will take a look and you can listen to this over and over. And if you have questions, you can call in or send me a tweet, or by next show, call me on 301-429-9247, and we can answer your questions. I'm Dr. Theo Oswala, your host. I'm a psychiatrist. My office is on Annapolis Road, 9470 Annapolis Road, Lanham, Maryland. And you can call my office on 301 301-577-9111, 301-577-9111. Thank you for tuning in. I see you again Thursday next week. Bye-bye.